My name is Carol DeMatteo. I'm an associate professor in the School of Rehabilitation Science at McMaster University. A concussion is a mild traumatic brain injury, and it's very common in children and adults, and we think it's increasing in incidence. A concussion is treated first by having it recognized and diagnosed as a concussion and brain injury. Then there are a number of things that can happen. People can go to emergency or go to their family doctor or come to a clinic that specializes in concussion to help them with the symptoms that they're experiencing after concussion. The signs and symptoms of concussion are many, in a word. So people may have headaches, they may have loss of consciousness, but not necessarily. They may be dizzy, they may feel foggy, they may have problems with concentration, and really have a lot more intense symptoms on exertion or trying to go back to some activity too soon. Well, we believe that just receiving the concussion diagnosis is not enough, because families don't always understand what concussion means, nor do the young people. So the concussion diagnosis has to go along with a lot of education about what that is and what they should do and what they shouldn't do after it. Well, we're learning more and more every day about concussion because it is a brain injury, that in fact repeated concussions are having quite a devastating effect on young people's brains and professional sports players' brains. And we also know that if somebody goes back to sport or activity, even school, too soon after a concussion, they could have prolonged symptoms or be at greater risk for another one. And probably one of the biggest things, we may not be able to prevent the first concussion, but we should be able to prevent the next one, and that's by not allowing people to go back too quickly, or the children to go back to sport too quickly or to school if they're not ready.